So now I welcome Camelia Tigau from National University of Mexico to the floor. Thank you very much, Camelia. We don't have Camelia?
Professor, you are...
Yes. Okay, sorry. So thank you so much for inviting CSAN, the Center for Research on North America, to organize these sessions. And the idea is to have 3 sessions on Latin America and India to compare the perspectives of Asia and Latin America. And we are very happy to have scholars here, such as Andres Solimano and Laura, and we're going to have more sessions like this. Now I'm going to talk about a particular case that happened here in Mexico about the medical personnel during the COVID pandemics. And I'm going to talk about some Cuban doctors that were invited to work in Mexico during the pandemics. As you know, medicine is one of the main occupations of skilled migrants in the US. There are about 10,000 licensed doctors of Mexican origin in the US, according to the census. Already previous to the current pandemics, there was the discussion in Mexico about the understaffing of Mexican hospitals due to migration and underemployment of specialists. But of course, it is in times of crisis, such as the present pandemics, that the scarcity of good quality healthcare pays. So this discussion has been more recurrent since March 2020, and especially because of a particular governmental agreement between Mexico and Cuba to bring in Cuban doctors to help along the crisis. So the Mexican government paid Cuba $6.2 million for the temporary services of 585 doctors during the second trimester of 2020. And the agreement involved not only direct care, but also advice, field work, epidemiological work, and a part of protocol analysis, which includes, in addition to doctors and nurses, biomedical engineers and epidemiologists. Now, did this happen the way it was planned? That's what I'm going to talk about today. This arrival has faced 2 main critiques. One that is directed to the conditions under which these people were hired, and the other associated to what some may call the discrimination against foreign workers in Mexico. The first one is the human rights of Cuban medical doctors. During the pandemics, Cuba has sent its health workers to around 70 countries as a way to increase incomes. According to Reuters, Havana kept 80% of what it charged for its doctor, at least to the ones previously sent to Brazil. According to UN sources, the working conditions of these Cuban doctors could be categorized as forced labor, a modern form of slavery. Now, this year, after the deployment of several contingents of Cuban doctors to at least 23 countries, amid the coronavirus pandemics, the US State Department attacked the program for its unfair conditions. Havana insisted that its army in white coats, which has battled cholera in Haiti and Ebola in West Africa, is one of the pillars of the revolution established by late Fidel Castro, and called Pelver and Slender on the declaration of the State Department. In response to these critiques, the Mexican authorities maintained that this was voluntary work and that carpe diem of Cuban doctors was paid by private donors. A second type of critique to the arrival of Cuban doctors came from the Mexican doctors themselves and has been also interpreted as discrimination against foreign workers, as I said. Mexican doctors complained that their Cuban colleagues were better paid and not really complying with the work that they were hired for. They were just taking the blood pressure and body temperature of the patients, some said. Cuban doctors are not prepared to put out fires of the coronavirus in Mexico, even when they receive higher payment, according to Mexican doctors. Now, of course, in turn, Mexican doctors were criticized for discriminating their Cuban colleagues. However, not all the salary goes to the Cuban doctors, as I previously noted. Some of the doctors have publicly confessed that they voluntarily joined the program because they receive a salary much higher than the $80 a month that they can earn in Cuba. Cuba, where health is free and universal, is one of the nations with the most doctors per capita in the world. Cuba has 8.4 physicians by 1,000 inhabitants compared to 2.4 in Mexico and 2.6 in the United States. Now I'm going to end my talk with two ideas for discussion. One is this focus on issues such as the discrimination of Cuban doctors who actually returned to Cuba in July 2020 that may distract from more serious problems of the political approach to fight the virus. Mexico, like other Latin American countries, has left lockdown early. Its number of cases is quite high, and we already have close to 50,000 deaths. Very few predictive measures were taken, not only speaking of healthcare preparation, but also to estimate the number of cases. For instance, there is a model by Sirkechi and Yusa Shahin. They have proposed a model of migration and travel intensity that could explain the outbreak of the spread of COVID-19 since it appeared at the end of 2019. Based on this model, a country such as Mexico, with a constant flow and the culture of outmigration to the United States, could have been better prepared and taken early measures to contain the spread of the virus. And the second idea, and this is very short, Mexico is following a broader trend of the overall medical migration during COVID. Preference is given to health workers over other types of workers to deal with the pandemics. And this is true for the case of Mexico, but also for other countries such as the US. Maybe I will turn back to the idea in the final round if there is time. Thank you very much.
Thank you very much, Camelia.